Tonight is our first inaugural session. We'll see how this goes. We wanted to talk about public leadership and taking action in times of crisis. I want to talk about black swan events, and I know that some of you were in the public policy analysis class with me, so you'll have a leg up on that. And put a little framework on what does it mean to be a leader during a crisis. I will have self-introductions with Sean Hallman and Jonathan Westendorf, and then I'll ask each one of them to talk a little bit about their experience during this time of crisis and their take on leadership and how to do that in an emerging change and situation we're all living in. And then I'd like to do a little bit of leading a conversation so that you can ask some questions to our alumni guests tonight and think about sort of the way I think about 7 steps to improve your decision-making and management in this crisis. So again, thank you everybody for joining us tonight. Really excited to have you and excited to have this conversation. So Emily, if you want to switch slides, there we go. You all know me. I'm program director and coordinator of our online master's degree. 2 favorite alumni, Fire Chief Jonathan Westendorf is joining us tonight from the city of Franklin, Ohio. Jonathan is a Haynes Award winner, which meant the outstanding capstone report. His team was such an overachiever that not only did they do their capstone report, their client communications briefer, that wasn't enough for them. So they decided to make a movie about what it meant to be doing emerging virtual reality technologies in the EMS, emergency management services field. So I know Jonathan has a great deal of expertise, not only in managing what's going on now, but in looking forward. He teaches himself at the college level and is currently completing his requirements for a doctoral degree in public administration. Sean Hallman, one of my very favorites, graduated in our 2nd class. So he's been out almost 10 years. We thank you for your service, Sean, as a veteran of the United States Navy. Located in San Diego, Sean is now a civilian employee of the Naval Civil Service. More interesting, I think, of all of the passion projects that our students and alumni engage in is the one that he undertook to build a whiskey distillery from scratch. And anybody who writes me and tells me that the value of their MPA degree was most useful in creating a whiskey distillery and not in his pursuit of public service demands a little airtime. Sean has managed to keep alive his small business and contribute to the public good by creating hand sanitizer as the output for his distillery during this crisis. So 2 very different perspectives and 2 top talents, and I think they're worth hearing from tonight. So thank you, gentlemen. I appreciate you both being here. We'll hear from you in just a minute. And let me talk about what is a black swan event. Again, those of you who've been through my public policy class will know one of my favorite things is good data visualization. So on the right-hand side, you have actually a stock market analysis, but it shows the history of what were considered black swan events at the time. Generally, it's shorthand for something that comes out of the blue. Now, there are a lot of academics and theorists who will make the argument that no black swan event is completely unpredictable. And if you listen to Dr. Fauci or the likes of Microsoft's Bill Gates, they will tell you that our key vulnerability has been and continues to be infectious diseases, such as the COVID-19 virus. So questionable about how much it's anticipated to come or not, but nonetheless, a black swan event is something that hits with some widespread ramifications. And once we've had it here, we have 2 questions, which is how do we predict it? What kind of hindsight bias allowed us to not see it was coming or not to be prepared? And more importantly, moving forward in this crisis time, what are the long-term opportunities? So let's move to the next slide. Just sort of setting the context. I really want to talk about and ask the alumni guests tonight, Jonathan and Sean, to talk about how they perceive leadership during the crisis and the unique role that as public servants they play. I think one of the things that is important to think about is defining the crisis in terms of what opportunities does this give you to move. In my role as coordinator of the online program, it allowed me to think about offering our online degree in a one-year format for people who might not be fully employed at the moment or just coming out of college and want to do a graduate degree very rapidly before they continue to pursue their career. Leadership means drawing on the preparation that you do have and often pivoting your perspective. Rather than thinking about what you know how to do, thinking about what it is you want to get done. And then I think we can all agree that it's the ability to make a decision and manage the circumstances that make for successful responses. And of course, in a federalist system like we have, and I know you've heard this on the news, 50 states are doing 50 different things. And so not only do we have experimentation at the governor's level, but within that we have counties and cities who are also seeking to identify the problems, figure out how to analyze it quickly, and then moving quickly to execute a solution. So in that framework, I'd like to turn it over and ask Sean, I think we'll start with you if you don't mind, to talk about your experience and your thoughts on leading in this crisis and how you've chosen to spend your time and energy.
Thank you for the invite, Dr. Dora, and welcome everyone. I think, so I'm going to approach this twofold because I have my current position, which is the Director of Training Analysis for a Float Training Group. And what we do is we train the ships and get them ready to deploy. And I'm sure everyone in the news has heard about the USS Theodore Roosevelt and the USS Kidd and the impact that that has on the protection of our nation when you have two assets almost out of commission due to the personnel issues that are going on. So one of the big things was the ability to flex because we're overarched by the Department of Defense, which rolls down to Department of Navy, and then to the different fleet concentration areas. So it was a hurry up and wait situation where we really didn't know what direction to go. So at the local level, we just took it upon ourselves to start developing policy to implement to stop the spread of the virus at the local area, which is teleworking for the military and the civilians like myself. And so that was something that was definitely new to the Navy. The infrastructure really wasn't there at the IT level. The threats from outside. So it was rapidly developing policy that like I have never seen before with all the red tape at the federal level. So from the Department of Defense, the Department of Navy, to the Office of Personnel Management, which actually manages the civilian force for the Department of Defense and federal employees, all coming together quickly and basically everyone being on the same page. So that was actually leadership like I had never seen before, to be honest with you. I was a Naval Surface Warfare Officer, as you mentioned, for 7 years. And normally to get policy passed, it's a 6 to 8 month. This was policy that was in place in a matter of days. So with that being said, on my distillery side, we're given permission by the Tax and Trade Bureau, which used to be the ATF prior to 9/11, at the federal level for distilleries to make and sell hand sanitizer, something that was needed basically worldwide. So you had the TTB at the federal level and the FDA coming together to say, hey, this is what you can do in accordance with the World Health Organization. So now you have you're bringing nonprofits in. And then at the state level, you had the alcohol beverage control at the various 50 states. And as Dr. Dora mentioned, 50 states doing 50 different things, which really came together, which was an issue in some states because distilleries weren't able to make hand sanitizer. But we were in the state of California. And so it it became a question quick. You have a very hot commodity that you could demand pretty much any price for. And we had to sit down and say, people need this. Let's basically sell it for cost. We'll donate what we can to nonprofits to get it out on the street, nursing home, first responders, hospitals. And then for businesses, we sold it, but not at a premium, which we actually could have demanded, but actually we sold it at cost just enough so we could continue producing hand sanitizer for those that need it. So it was something we were used to making, this stuff right here. Whiskey, we had to completely shift our production. We had to contact the state and the Tax and Trade Bureau to make sure that we were in compliance. We had to register with the FDA to make sure that everything was in compliance. And then also at the organizational level of the San Diego Distillers Guild to make sure that we were all on the same page, that everybody was in compliance, because it only takes one bad apple to spoil the whole bunch. And there were a couple distilleries that were charging outrageous prices, and I imagine they're going to get a call from the Attorney General at some point. But, we wanted to make sure that we were getting this into the hands of the people that need it.
Thank you, Sean. I appreciate the description. It's important work you're doing. Chief Westendorf.
Hi, everybody. Again, thank you, Dr. Dora, for this wonderful invitation. It's an easy answer anytime Dr. Dora calls, because I absolutely love my Trojan family. One of the things that I absolutely love the best out of my time at USC was really working with all of the students, the mid-career professionals from across the country and other nations, from the military folks. Getting to work and learn with them was absolutely unique. When I started USC, I felt like a major imposter. If you think that I'm a fire chief and that sounds all big and fancy and everything, I'm a fire chief of 47 employees. I cover an area of 27 square miles or so, and there's about 20,000 people in our community. So while it sounds all grand and everything, it's just a small community fire department. We are small in all regards. Ohio is very unique because we have this home rule situation where every community basically has their own fire department. We each have our own chief. We each have our own ladder trucks, and it's hugely inefficient economically. However, we are able to tailor our needs very specifically around what is needed in a community. So there are always trade-offs on both of those. And I've never quite felt like I fit in my community. So my time at USC with people who think big and want to make a meaningful difference and an impact on society really fit me very well. And I have found that has just done nothing but propel me even further. So because I had all this wonderful opportunity to work in a community, I've been the fire chief since I was 27 years old, so going on 20 years now. I decided to take all of this newfound experience and knowledge working with nonprofits and everything and challenge myself. So I ended up, I was always involved with the Ohio Fire Chiefs Association, but I became a board member. And I ran and am currently the president of the Ohio Fire Chiefs Association. So we have 1,700 members of fire chiefs across the state that we're representing. And we worked really, really hard to get our association in a position that was a little bit more competitive, a little bit more dynamic, and looking towards the future. We certainly didn't expect this to come out, but a lot of the things that we did put us in place to be ready for that. My time at USC has taught me to ask the right questions. It's easy to ask a question, but asking what the right question and digging deep to find out which questions are going to provide meaningful answers and direction, and how to direct an organization as big as the Ohio Fire Chiefs or even as small as my fire department is really important. And I think that USC did a fantastic job because what they taught me was how to research. And I have used that in every way imaginable. And one of the things that came out of this is learning how, actually it was part of a capstone challenge project a couple of years ago. Dr. Dora reached out and said, hey, you're right south of Dayton. Would you help us through this harrowing capstone challenge? And that launched me into delving very deeply into substance use. And through that, I recognized that public health has a lot of answers to national and local problems. But I have found throughout my time in local government, public health is horrible at communicating with the public, and they're horrible at operationalizing that information, at least from a local provider's perspective. I know they do great work within their environment, but they are not very effective in reaching out. And I think we're seeing that play out in a lot of ways right now. So what I started doing was I started working on substance use and really kind of understanding better public health. And my doctoral work that I eventually ended up starting because I missed Dr. Dora too much, was to go back and start figuring out how we could use public health at the local government level and make a meaningful difference. How can we improve the quality of life? How can we help those people that are dealing with substance use? How can we save money in a lot of different ways by using some of those principles? So I have been very keyed into public health for a while. And as this COVID thing started playing out, it just really kind of piqued my interest. And I was very interested what was happening from a policy perspective through China and through the different nations as it was working its way over to us. But again, fortuitously for me, my role at the Ohio Fire Chiefs Association put me on an inside track with Governor DeWine, who's the Ohio governor. And he and his team, Dr. Amy Acton, were among the very first to make significant changes, policy changes at the state level. So a nice USC tie-in. Arnold Schwarzenegger has the Arnold Classic, which is a fitness competition that happens in Columbus. This 4 or 5 day scenario ends up being a $50 million economic impact for the city of Columbus alone. And they very early decided to curtail that event in big ways. They had 80 different nationalities coming to Columbus to compete. And they decided to allow the competitions to occur. However, immediate family were the only ones. None of the fans that come to this thing are allowed to show up. They canceled the trade show part of it. Basically, everything that impacted the community from a financial perspective, they canceled. A lot of food got sent back and all of those things. So, and they took a lot of heat about that. But it was interesting because, again, I had that ability to work with them early on. So as that proceeded, I came back and had a meeting with our city manager and leadership team, and I said, hey, I'm not liking what I'm seeing from a public health perspective. If this plays out, it's probably going to have, it's probably going to have a big impact. I don't know to what degree. But if this happens, this is what you should anticipate from a pandemic. So again, you just take those research skills and start doing some homework, and you have the answers right in front of you of what's going to be happening next. So we had some conversations about, hey, maybe this includes working from home. Maybe the fire department's not giving station tours and going out to the schools anymore. And how do we manage all of that? And quite frankly, we sent an email out to notify council, hey, this is what we're thinking about. And council's reaction at that time was pretty swift, and they were none too happy that we were having these conversations. And I said, okay, I get it. I understand. However, I'm not saying this is going to happen, but if it does, these are the things, and we're simply just trying to be proactive with it. It took very short period of time before more Ohio Department of Health restrictions started coming out. And it became very clear very quickly that those early conversations and those ideas and brainstorming were pretty useful. We were in about a week and a half able to shift the entire city into a work from home environment. Police and fire obviously would still be there. Public Works, we ended up shifting and keeping crews separate. We moved some of my firefighters' campers into the back of our building so that if we did have to quarantine in place, we could do that. Because again, like I told you, we have a very small staff with 9-10 people on shift at a time. And if one shift gets taken out, that impacts us significantly. So we started making those kinds of modified shift and staffing models, the campers in case we had to quarantine somebody. And we started working on trying to get the county ready for what was coming. Because again, you know, like I said, our county health department, not real proactive. Some fire chiefs got together. We approached the county commissioners and asked them to declare a state of emergency. We were met with some significant resistance. Warren County is a probably one of the strongest Republican-held counties in Ohio. Ultimately, this was during the days when nobody believed this was a real thing. It wasn't a real pandemic. We didn't have one single person in our community. Lots of backstory with all of that, but essentially the decision was made and it was clear that they were not going to declare an emergency. So we came back to the city of Franklin. The city of Franklin declared our own emergency, and we began working our plan. And it has served us very well. We have been ahead of the curve throughout. PPE is a big deal everywhere. PPE meaning personal protective equipment. My fire department, we had about 150 N95 masks, which is a lot for traditional operations. These are not things that we would typically do. We have spent countless hours trying to track down N95s because we have shifted into an environment where instead of just going in and dealing with a particular potential infectious patient, we're dealing with every potential encounter that we have with the public is an infectious disease exposure. And we just couldn't put our people in that position. The Strategic National Stockpile is designed to support operations of a disaster. It is not designed to support the disaster of a nation, of the world, actually. And so we have had to work our way through a lot of those types of issues. CDC guidance has changed on a daily basis, sometimes hourly. Trying to keep up with all of that, tremendously difficult. Firefighters are notoriously stubborn. They do not want to change what they do. Keeping them safe has been a nonstop battle. I receive coded notifications through our public health today. And as of today, I'm still chasing down employees that were not wearing proper PPE on benign calls that shouldn't have been COVID, but now they're tied up in the middle of this. So it continues to be a struggle. People just are stressed. They're not encountering the changes very well. Everybody right now across Ohio is starting to get very antsy. They want to go back to normal. That's a challenge because ultimately we're going to be faced with the health challenges that we have thus far avoided as people go out and start re-engaging in the world. Mental health is a big thing. I'm watching people who I know are very smart, intelligent, critical thinkers make very strange decisions. Those are all byproducts of mental health and stress. Substance use treatment is very difficult because it's not safe to put people in close encounters inside somebody's personal car to transport them to a treatment facility. So we're trying to figure out how to do that virtually. Excuse me. Working through the HIPAA regulations and trying to understand, trying to help public health understand HIPAA is not about keeping information from the people that need it. It's about keeping information from the press and those other kinds of things. Those are just all very difficult challenges that we've had to work through. Also, obviously, we now have to deal with the economic impact. So all of us, all fire departments across the state, have seen about 50% decrease in the amount of responses. So it's interesting because people don't seem to be having heart attacks. People don't seem to be having strokes. I have a good friend that is a hospice nurse. Hospice people, admissions are actually down. So it's been a very interesting thing that has happened, and that's impacted the health system in all sorts of different ways. So we've got some definite financial challenges due to loss of billing revenues, during loss of obviously personal income, income tax, property tax, the ability for people to pay their homeowners insurance and their mortgage payments and all of that. Those are all very difficult things for people. So we at the Ohio Fire Chiefs have reached out to the Ohio Municipal League, which is kind of like ICMA, the Ohio version of that, our township associations as well as our counties, and we are working to develop a strategic task force so that local government can try to figure out how we're going to manage all of these economic costs. As you might imagine, I can go on and on about this. I won't, but I'm happy to answer any questions you guys have later. But to say that this is a monumental, big shift in everyday business, that would be a huge understatement.
Thank you, Jonathan. This last slide, really on the right, data visualization, as you know, first appeared on the front page of the New York Times in terms of the unprecedented unemployment claim factor. On the left, there are my sort of thoughts about ways to think about decision-making and management. Rather than going through them, I think maybe we'll just open up for questions. As key takeaways from Sean's presentation, what I heard was this crisis has allowed for rapid change in an organization which is not known for rapid change, which would be in the U.S. military and the private firms that serve in the U.S. Navy, and in particular making good use of project management skills in the middle of that rapid change. And the second point Sean covered that I heard was what was a critical skill, what we call a soft skill in the graduate school world, but is the ability to coordinate and collaborate. That without the coordination and collaboration skills, managing in a crisis situation is just nigh on to impossible to get anything done. From Jonathan's presentation, my two takeaways were the importance of communication, in particular the examples that he gave us about public health leadership and the difficulty to communicate to a broad audience, not only sometimes your own people or the decision makers that you need to get to actually take action, but then to be able to communicate to the public on all kinds of levels. And then the second takeaway was the need for policy changes and the policy changes that are happening in real time and or need to happen. Difficult for people to give up sort of their past status quo practices and their expectations about what should be in order to make those policy changes. So with those couple of points for each for summary and this set of questions on the slide deck, if you want to raise your hand or put your question in the chat box, I am happy to moderate. Anybody want to unmute and ask Jonathan or Sean a question or share their own perspective on any of these questions? I'm happy to moderate.
I have a quick question for Jonathan. Can you all hear me?
Yep.
We can, Nora.
Okay, perfect. I just wanted to double check. I was just wondering, you touched on it a little bit with the, I guess, kind of political party different stances. How has your community been able to overcome that to get the valuable information, orders to the citizens of your community, and I guess kind of to the state of Ohio as a whole, based on that kind of divide that we're seeing more and more of as the stay-at-home orders go on?
So I would say that Ohio, I think, part of the problem is I think that, talking with the governor's office, they did not expect that the community would react as swiftly as they did. When they said stay home, they did that. People really did stay home. And what ended up happening, I think, is that they ended up stopping the spread that they probably counted on to help reinforce what would come later. And, ultimately, when we talk about keeping people from home and closing businesses, and we know ultimately those decisions mean that some people are not going to make it. Those are very hard political decisions to make. And what I really like about Governor DeWine, and this man has a long, long history at both the state and federal level in elected office. He's in his low 70s. He planned to run again, but ultimately he's in the twilight of his political career. So he's a little bit better positioned to say, if I don't win the election, I'm not going to win the election. I'm going to do what's right for my family. And my family includes all of Ohioans, right? So I think ultimately, very early on, people were scared. They used crisis management and precaution advocacy very well to their benefit to get people to act. And everybody has been on board with that until the numbers didn't play out. The idea of flattening the curve when there is really no visible curve became very challenging. And the politics of my families are financially hurting. We know that violence is increasing in the home. We know that there's no reports of child abuse that are taking place because these kids aren't with their teachers or their aftercare providers. All of those, that real life thing hits. And all of a sudden, the question becomes, obviously, I'm sure you guys have heard, is the cure worse than the disease? And that is what is ultimately playing out right now in Ohio, as well as much of the rest of the nation, from what I can tell. But ultimately, it is very hard. I think that, if you are friends with me on Facebook, you will see I am banging the drum and carrying the banner as high as I possibly can. I purposely go out and look for controlled fights where I can have dialogue with people to try to help get them recentered in a way that is nonpartisan, but from a policy perspective. It's interesting because public administration and politics are not the same things. And to figure out how to navigate that, I find it very enjoyable. I kind of have fun with it. A lot of our alumni all kind of join in and together, and we just kind of have discussion board debates and everything like we used to, and we enjoy it. But it really does have an impact. And it's funny because I have all of those people that would never say anything in public, but they text me or I'm always watching what you're saying. I enjoy it. I read it, all those kinds of things. So that for me just reinforces that there is an audience and you're using that audience appropriately to help people challenge what they think they know and try to inform them with that real data, with sources, the things that we all make decisions on. I try to inject that in my social media and in all of the decision-making processes throughout all levels. And ultimately it becomes very hard to debate and discount that because it's real and it's something you can actually point to.
Thank you, Jonathan. And we have a question from Rob Nordahl. His Navy office, if I pronounce this right, Rob, EXWC Port Hueneme. This question is for Sean. His Navy office made a quick change to telework that Sean had talked about. So, Sean, how else do you believe the DoD will be affected or improved by this crisis of the decision making that's happening now?
So one of the things is, I think travel. That was really impacted because we are a worldwide organization, and our particular organization we have a location in San Diego, one in the Pacific Northwest in Everett, Washington, one in Pearl Harbor, Hawaii, and then Sasebo, Japan, and Yokosuka. So I think long term, I think more control is going to be put at the local level to impact in case a pandemic or something like this happens again. Instead of everyone waiting, nobody knew what to do. Our particular organization had people all over the world at the time, on board ships, at different locations internationally, on the East Coast, augmenting different organizations, and everyone was waiting to find out, what are we going to do? I think that there's going to be something put in place. The one thing I remember from the very first class I took was the culture of an organization and the structure of an organization. I think you're going to see the ordinance for when something like this comes out. I think you're going to see a lot flatter organization as opposed to the vertical organization that the military is known for. So I think that there are going to be instruments put in place that will allow these decisions to be made rapidly in order to save people's lives. As I mentioned before, we saw this play out on national news on the Theodore Roosevelt. The commanding officer did not feel like he was empowered to make that decision in order to keep his sailors safe. And I think that is definitely going to roll over across. As you notice, most of this is the Navy, just because of everyone being confined on board a ship, on board a submarine. And there has already been policy put in place that the commanding officer has the ability to keep everyone on board for as long as he needs, especially for ships that are deploying. Just from the fact that there can be an incident where someone is infected, is brought on board, and you have an incident like the USS Kidd, which is in port in San Diego right now, with a majority of the sailors that are infected and off the ship right now. So now you have an asset that is designed to protect an aircraft carrier that is pierside and can't get underway. So long term, I was even saying the short term, that policy is going to be written that is going to allow commanding officers and local commanders to take control to prevent any long-lasting effects that could definitely impact the mission of the service.
Super interesting, Sean. We have another question, military questioner. Hi, Abe. Glad you're here. But for both of you, maybe you could answer in order. The question is regarding the redesign of the status quo related to the stay-at-home policy and health surveillance. How do you anticipate integrating data surveillance, safety, and privacy laws into the future health safety effects? That's an excellent question, I think, talking about as we move away from some of our understanding about what is data security and data privacy and move into these concerns for surveillance. Sean, you want to go first, or Jonathan, either of you?
I think, we're already seeing it in some cases. I'm having questions asked to me that normally my doctor would ask. Do I have a fever? Do I have a cough? Whenever I have to go into my office every now and then just to check other computer systems. And, that's the first thing before even coming into the building. Do you have a fever? They take my temperature. And this is all logged. Everyone, this is something that's kept. We're reporting on a daily basis all the way up to the CNO. How many cases do you have? What's the personnel? I think you're going to see this fast track where this data is going to be compiled and it's going to be rolled up for future pandemics or other outbreaks for something like this, just so they can build a trend to see how fast it's spread. So I think you're going to see privacy laws actually, and Jonathan mentioned HIPAA, this data is going to make it into the mainstream outside of the medical community. I think it's one of the things that you're going to see is to drive production for PPE. It's going to drive production for other essentials that are going to be used to protect people in the future. I think the data is going to be used the same way that Facebook uses data to drive you to particular websites, or when you swipe your loyalty card at the grocery store, you start getting the coupons for the stuff that you buy. So I think that data is going to be used in a similar way.
Jonathan, you want to weigh in, or I have another question for you?
Real quick, I would like to say, technology is my thing. I love technology and I love the debate of policy. And hey, I told you at USC, I love to ask the questions, and this is a tough one. You know, right now I've got an app on my phone. I use it every day. It's called COVID Symptom Tracker. It's from Massachusetts General Hospital. And basically it's a 2-question survey every day. Have you received treatment for COVID? And do you feel normal? From the fire service side, there was an app a while ago of determining whether somebody had a loss of taste buds and those kinds of things, and a loss of taste of smell. We've seen that those have now been released as some confirmed indicators of COVID. So, you know, I think technology is definitely going to be used in a lot of ways. The one thing I would say that is very interesting to me is it is interesting of how loudly people want to go back to work in their vocal speech. But when, as we're having conversations today of implementing the policies that they're going to have to come back to, how suddenly all of a sudden nobody feels comfortable going back to work. They don't want to be exposed to the people, or there are people that are certainly making more money on the supplemental benefits that are coming out than they make at their actual full-time job, which is unfortunate. So getting things restarted and making sure that people really want to do what they say they want to do, and at the same time having a populace that feels safe enough to go out into the world to buy those consumer goods, to go to Disneyland, to eat at a restaurant, whatever that is. You know, I think that you're going to have to address that in some way. And technology is definitely going to have play a role in that. And people are also already so distrustful of technology as it is. So I think it's going to be very interesting.
Beth Trimble makes a good comment that this growth in data systems and surveillance tracking and analysis overlaps with the public administration that we're all learning about, and in fact will be an even greater role for policymakers with backgrounds like we all have to think about some of these issues as we move forward, we get past this crisis stage. I think that's absolutely true. Jonathan, Cheryl Verhulst would like to have you go back to the conversation about politics and keeping policy separate from politics when so many people interpret policy through their own political ideological lens. Could you address the trade-offs or the confrontation between strong opinions and the actions that need to be taken or not taken for public health?
Yeah, I wish I knew. It's a moving target, right? I think ultimately, one of the things that I like about public administration is the fact that you can point back to some frame of reference. I have the opinion, and this is again my personal opinion, that the partisan politics are in the way of really serving the public. And what I like about working for a small size department is that when I have a request from employees, or if I'm trying to lead my administration, the city administration, the executive team in some way, I'm always showing up with, they make fun of me because a lot of times I'll show up even with a binder at times. Because if you want to make a policy proposal, or if you want to make an impact, you have to have something to point back to. And when you take out that partisan piece of it, you get to find common ground on both sides, because it does exist. People forget it, but it really does exist. And people get things done in the middle. They have to. Otherwise, nothing would get done. But unfortunately, politics and the money that's behind that is about the extremes, especially far out. As you get closer to an election date, it gets to move closer to the center. I'm reminded of representative, responsible, and responsive. We're representative of the public. When you're making decisions, you have to make the decisions that benefit the public. That's why we do this. That's why people trust us. We're responsible for upholding the rule of law. Laws exist. Sometimes they're in the way, but they do exist, and you have to follow those. You have to adhere to that. And you have to be responsive to the public interest. You cannot ignore the fact that the majority of the population wants to get their businesses up and running and wants to restore their personal income. You have to be responsive to that. And I think that's the art of public administration. There's certainly a science to it, but that's the art. And that's where I love to practice and have fun with it.
Thank you, Jonathan. Rob, I'm going to skip your question and come back to it in a minute. A couple of comments. Abe was talking about what we did after 9/11, which was implement alerts by color coding. And of course, Amber alerts and other notifications would get pushed to our phone. Nora talked about in her state that, Nora, if I understand your comment right, that new threats during COVID and in crime spree situations get pushed to your phone. And I know that as a USC student, faculty, and staff, you can sign up for alerts I get them all the time in the middle of the night when something has happened at USC, or they've closed down a particular block and or reopened it after an event. So comments, Jonathan or Sean, about the positive side of the surveillance or the ability to then communicate with the public?
I do know that California has used some of the wildland firefighting notifications to notify of particular hotspots. I don't know too much other than that. I just think that we're in the blessed and cursed position of there just hasn't been this eruption of cases that we kind of anticipated. But I think ultimately that type of technology would be utilized. I know that in the state of Ohio, there's a lot of attention being paid to the prisons and a lot of attention paid to nursing homes, skilled facility care centers. So all of the family members that are exposed to that are certainly aware of it. And there's definitely communication systems that are being stood up to make that work a little bit better.
Sean, I'm going to ask you the same question. Does that work at all in the military environment that you're in San Diego? And sort of related to that, once you had decided to create hand sanitizer from otherwise what would have been great whiskey, how do you communicate that to where the need was or get that to the people who actually needed to have that product?
On the first question, yes, absolutely. It takes a lot of coordination. Believe it or not, that every area has a regional commander, and their whole job, they're normally called the mayor because they coordinate with the city. So when events like this happen, you see these alerts go out, and that brings everyone together. It happens, especially here in Southern California during fire season, when you coordinate military aircraft, coordinating with civilian aircraft in order to fight fires. We saw the alerts and the calls for help that were through back channels, but before you know it, you see the USNS Mercy and the Comfort in locations to assist with cities. So we see it on the military side through coordination and communication to identify where these hotspots were, especially in the San Diego County, and getting all the organizations involved in order to keep this from spreading even further. The hand sanitizer side, that was interesting. That was multi-pronged through the guild, through press conferences with the city, and social media. So press releases, the San Diego Distillers Guild they released the information with all the distilleries, websites, and point of contacts in order just to say, hey, we are making hand sanitizer. It's FDA approved. It's the World Health Organization formula, 80% solution. Come and get it. We have, and like I said, we allocated our particular distillery, we allocated a certain amount for donations, and that it ended up being a flood of requests coming in. So we had to prioritize and decide who we were going to support, who needed the most. We put businesses kind of at the bottom of that, and we put first responders and healthcare workers at the top. in order to get the information out in the spread by word of mouth we worked with the cities. There are different police organizations that organize on the civilian side for the city to get that information out to the different organizations that hand sanitizer was available, and we're still making it.
I know that I talk about social media and I preach every time we have a new student residency, the importance of that as a digital tool. And I will continue to do that, because thank you, Sean, for the reminder, and Jonathan, you too, for how important that social media tool has become in a very formal setting to sort of communicate with, quote unquote, the public and our public. I want to go back to a question, Virginia, thanks for your question, but I want to go back to a question that Rob asked earlier, although it's a bit of a spoiler, because those of you who might be going into Capstone this summer may see this issue again, and I open it up for anybody who wants to answer. Those of us who watched with horror at what happened in Wisconsin when they had a election and people were standing in line for hours, and socially distance was not actually something that could happen. How do we keep our elections safe in November? And more importantly, is it even possible to communicate a process for keeping elections safe if we can't convince everyone that we go to a paper ballot system or some other kind of mechanism that we don't currently have?
So in Ohio, it was interesting because up until the day before our primary, the governor and the secretary of state, the lieutenant governor were just banging the drum that the election is safe and we need you to show up, we need you to vote. And at the very last hour, they made the decision that they were canceling the election and would move it back to a date in July, thinking that they could move it back further. And in the state of Ohio, the legislature actually selects the date of the election for it to be held. The legislature decided that they would do an all-mail absentee mail ballot system. Overall, they were able to pull it off. They ended up with some long lines. Yesterday was the primary that was held, as people showed up for various reasons. And, they did maintain the distance. We didn't have any problem as far as that goes, but it did go to the end of the line. If they're going to try to do this in any other way than they have done in the past, they are going to have to convince the populace that mail voting is safe. Nobody believes that. It doesn't seem to me. Voter fraud, everything that has happened, the conspiracy theories abound. They're going to have to invest in significant time, energy, and money into trying to convince people that it is safe, and they're going to have to communicate that well in advance of November, or they're just going to have to figure out a different way to do it entirely in person. And I don't know. Well, time will tell, I guess.
Dr. Dora, I know one in California, there will be some logistical issues because so many people open up their homes as polling places. And we've already heard some chatter that people will not want strangers on their property to vote. So now you have to find a lot of public locations in order to actually physically go and vote. So, there's a logistic issue out here in California just because of the sheer number of just the population and the availability to actually get someplace and vote.
It's interesting because in all the work that I've done, the research suggests that in actuality, mail-in ballots do not favor one party results over the other. Now, that's not to say that the rules about getting on the ballot or requiring signatures to be on the ballot or absentee voter drives to get people qualified to vote by mail that there isn't a differential in implementing elections and those elements that actually can push the outcome. But the actual technology of voting by mail, I believe, is yet to be proven that in fact it benefits one party over the other. But these are all really great conversations. I promised Jonathan and Sean, while I was taking time away from their busy schedules, that we'd wrap up in an hour. Maybe each one of you gentlemen would mind sharing your email address or whatever contact information you'd like in the chat box, so that if any of you would like to talk to our very smart, very active, engaged alumni, I know that both Sean and Jonathan would be happy to do that. So thank you all very much for coming out tonight. I guess, oh, there, Emily's already beaten me there. There's the slide deck at the end with the contact information. Rahm Emanuel, who, as you may have known, was White House Chief of Staff and Mayor of the City of Chicago a long time ago, had a wonderful quote, never let a serious crisis go to waste and always turn that into an opportunity. So I will remind you that as difficult as semesters we've just been through, and as hard as this is on all of us here, particularly the people who are suffering the loss of family and friends, this is a wonderful time to be a public administrator and to be working on the public front lines and to make a huge difference. You all have immense talent. We appreciate you being part of the Trojan family. And thanks for your time tonight. Thanks, Jonathan. Thank you, Sean. Thanks, everybody.